I have one question for Dr. Neelam Mohan ma'am also. So ma'am, although there is significant research of the association of dietary discretion and improvement of various GI disorders, do you see similar effects with diet on pediatric liver diseases also? I know we've discussed this, but if there's anything else to add on this, and any advice to the parents of children who are a case of various liver conditions, are there any dietary advices that you would like to provide to the mothers with children having pediatric liver conditions?
Yeah. So three things related to celiac. Earlier, there was a myth that if you introduce the celiac, the wheat late, it might help you to prevent the celiac disease. Then there was a myth if you start at 4 months and, all that. So I think eventually what we moved at understanding is doing the right things at the right time is the best thing to do. So introducing wheat at around 6 months, complementary feeding at that is what we've all said, because a lot of parents ask this question. Second is that it is very important, as Avi said, about now we want the parents to get it straight into their head that we say no to sugars. And of course, salt also, we are saying no to sugar for the first 2 years of life at least. The reason is that whenever you introduce sugar in life, you will always have, it's like an addiction and you always go ahead accepting that. But if you do not introduce vegetables at the right time in a child's diet, it's going to be very difficult for the child to accept that. So my message, to the audience is, please say no to sugars, cokes, cool drinks, and all this stuff, and focus on introducing vegetables and, of course, fruits in the child's diet in the first couple of years, because you need to get that taste right into it. And sometimes when the celiac patient is so undernourished, majority of the time, small cohort is obese. So when you end up and they start getting better, so whatever they eat, they start absorbing. So the parents earlier, they were not absorbing. So they were used to giving a child, say, 3x, and they continue to give 3x, but now the child is not absorbing 1x, may absorb 3x. So that's how they really tend to get obese also. So it's a very important message that you need to understand in the diet. When we are talking to you about a gluten-free diet, Ishi is there, she would say how important it is for a nutritionist to explain. It is just like, obviously people think wheat is a protein, so you're cutting down the protein. How do I replace it? Because rice is going to be all more carbs. So they're going to give you alternatives to ensure that there is enough replacement of protein in a diet, especially in an Indian diet who are vegetarian. So that's very important. And second, how to avoid getting overweight and obese, because you're ending up taking this alternatives and you're used to eating more and all that stuff. So this is the message I would want to give. And third message is, we tend to take things for granted once the diagnosis is made, and we think, oh, it's over with the doctors and the nutritionists in life. And that is like not really good, because it's a good thing at least to be in touch with the with the doctor. The doctor who has made your diagnosis at least once a year, and especially when the child is growing, the adolescent phase, the requirement, the need of nutrition, everything needs to be holistically looked into. And it's just not the diagnosis, my dear friends. It's like following it up throughout your life, and that lifestyle which needs to be reiterated. All of us love to be said, I love you, even if we know we love each other. So it's the same thing. It's very important to keep meeting those patients and understanding, and once in a while look into where things are going wrong. That's all I have to say.